So let's go back to the beginning. What was the problem that Medicare set out to solve?
Well, it was both a substantive problem and a political problem. The origins of Medicare are in the ashes, the failure of the Truman administration proposals for national health insurance during the mid and late 1940s. And after they had lost repeatedly, health reformers decided they needed a new strategy. So instead of national health insurance, what today we would call single payer, federal government run program for everybody, they trimmed their ambitions down to initially just hospital insurance, 60 days of hospital insurance for elderly Social Security beneficiaries. And that was it. And they thought if they just focused on older Americans, maybe they would tamp down the controversy and the opposition in the American Medical Association and charges of socialized medicine, all things that had really thrown a wrench into plans for national health insurance. It didn't quite work out as they thought. It took about 14 years from the time Medicare was proposed to enacted, and there was a big, divisive, controversial debate about Medicare's enactment, but it was fundamentally a solution to that political problem of how do you enact government health insurance in the United States. You pick a more sympathetic population. Now, there was a substantive problem, which was in the 1940s and especially 1950s, private health insurance was growing in the United States for Americans who are working age. And that growth of employer-sponsored health insurance really left out retirees. They were expensive. Commercial insurers didn't want to cover them. And the uninsured rate, if you can believe it, for people over age 65 before Medicare was around 50%, not 15, but 50%. And so here you had a population that had more medical needs, was more expensive, and they had less access to health insurance than younger people. And Medicare was created in part to end that disparity and give them access to reliable coverage.
How have the politics of Medicare changed over the years? I mean, at the beginning, it was reported by Democrats and opposed by Republicans. And, now it's President Trump who says, "Thou shalt not touch Medicare."
There have been some twists and turns. If you look at the vote on Medicare enactment in 1965, it was not the vote on Obamacare in 2010. There were some Northern Republicans, moderate liberal Republicans who voted for it, and conservative Democrats who voted against it. So it was mainly a partisan debate, but not exclusively a partisan debate. And I would say in between 1965 when it passed and 1995, the politics of Medicare were consensual. There was a lot of bipartisanship. If you think about the payment reforms in Medicare that we have today and that shape Medicare today, the prospective payment system, the Medicare fee schedule, those were sponsored by Republican presidents and supported by bipartisan majorities in Congress. And as you will vividly remember, because I know that you covered this, the biggest attempted benefit expansion in Medicare's history at the time in 1988 was sponsored by Ronald Reagan, a conservative Republican. In 2003, the expansion of prescription drug coverage was under a Republican president, George W. Bush. So the partisan tides have not flowed in predictable ways.
So let's talk about privatization. Medicare Advantage, the private health plan alternative to traditional Medicare, is now more than half the program, both in terms of people and in terms of budget. Is this the future of Medicare, or will we look back in many years and see it as kind of a temporary diversion?
I think it's the present and probably the future. I mean, this is really a shocking outcome historically, because what Medicare's architects expected was that the program was going to expand government health insurance to all Americans. First with the older population, then adding children, then adding everybody. Did not turn out that way. The original aspiration was Medicare for all through incremental means. Instead, 60 years later, we don't have Medicare for all, but Medicare is mostly privatized. It's a hybrid program with a public and private component that increasingly is dominated by private insurance. And the fact that over half of Medicare beneficiaries are enrolled in these private plans is a stunning development historically. I don't think Medicare Advantage is going anywhere. I think the question is, how big is it going to get?